What if I tell you that there is a very powerful and very simple habit that you are not taking into account, and that can greatly improve your health? We have already talked countless times on this channel about the benefits about your physiology of physical exercise. In fact, I think it's one of the most powerful messages that can be given on this channel. But be careful, because you don't have to be a super athlete to benefit from the benefits of physical exercise, pardon the redundancy. In fact, if people knew how simple it is to benefit from movement, there would be much less sedentary behavior. Much less. Today we talk about a very simple gesture that may catch your attention, but that is, as simple as it is, beneficial for your health. It's about taking a little walk after eating or throughout the day. Exactly, walking after eating. It may catch your attention, but I'm going to convince you that this gesture, this minimal change in your routine, can make a difference. A small walk of about 10-15 minutes after eating can, for example, improve your digestion. The movement of the body is associated with the movement of the intestines, as reflected in this article. And this is especially interesting in people who suffer from gastroesophageal reflux, and obviously after eating the reflux worsens if you lie down or sit down. But if you walk even for a short time, you can greatly reduce the symptoms. It's going to help you a lot to improve and control your blood sugar. And this is especially interesting in type 2 diabetic patients and also type 1 diabetics. Postprandial blood sugar, that is the physiological increase in blood sugar that occurs after eating, especially after eating carbohydrates, is greatly reduced if we walk a little after eating. We know that postprandial hyperglycemia, those blood sugar spikes, which are more spikes the more simple sugars we eat, that is, they also depend on what we eat, obviously, but they are not good for anyone, neither for diabetic patients nor for non-diabetic patients. I will show you a very interesting study published in 2016 that talks about how taking a small 10-minute walk after main meals is more beneficial, mind you, than taking a 30-minute walk at any other time of the day in terms of glycemic control. Mind you, taking a small walk after each meal is more beneficial than taking a long walk at any other time of the day. As I always say, active muscle is like a magnet for that glucose that's circulating in your system before being metabolized, before being stored as glycogen in the muscle, or before being metabolized to fat through de novo lipogenesis. If you give your metabolism the opportunity for the muscle to suck up that glucose from the blood, then that postprandial blood sugar is going to be much lower. Those blood sugar spikes are going to be much less pronounced. It lowers heart disease risk, and we've known this for decades. It's worth remembering that physical exercise at the cardiovascular level is probably the most powerful intervention for maintaining cardiovascular health. But there is a nuance that is often overlooked. People generally think that you have to do physical exercise for a long time, that is, continuous sessions of at least an hour, for this to have any kind of benefit, when this is really not the case. And studies prove it. In fact, from an evolutionary perspective, the human movement pattern has not been to sit or lie down for 8 hours and then do a 2-hour workout. Evolutionarily speaking, this really makes little sense or has been done few times. The movement pattern has more resembled small and continuous periods of physical exercise throughout the day. That is, small snacks of movement, small pills of exercise, and this can be emulated today, for example, going to the pharmacy by bicycle, going up to the room by the stairs, parking further away when you go to the supermarket, taking that 10-minute walk after eating, with 30 squats between study sessions. Use your imagination. But those small pills of exercise, at the end of the day, when it's time to sleep, if you start to think about it, they have represented a voluminous and important amount of exercise, and they are granting you benefits. That is, the perspective of many people is the following: either I'm going to train and I train my hour and a half, or I haven't done anything, when really that concept is wrong. Even if you're not going to train and you don't train for 30 minutes or 40 or 50 minutes, if you do these small exercise pills throughout the day and you do at the end of the day, well, 4, 5, 6 exercise pills, that's going to make the difference. Sometimes less is more. It also lowers blood pressure. And another study tells us the same thing, that 3 10-minute exercise pills, in this case walking, throughout the day are more effective in lowering blood pressure than a continuous exercise session. The previously explained concept. And notice something that maybe you haven't thought about. These exercise pills accomplish 2 goals, not just one. First, gaining physiological benefits from physical exercise. Those 10 squats you do after studying the 800 topics of medical pathology. 2, well, they stay with you, don't they? You already have the benefits. Once you've finished, you already have the benefits. But in addition, you're breaking another very harmful pattern, which is staying seated for a long time. Essentially, you quit inactive habits and gain from exercise. These are two different things because it has been shown that sedentary behavior per se, and regardless of the exercise one does, is negative, it's harmful. That is, a person who trains for an hour but is not sedentary versus a person who trains for an hour but is sedentary, the first person has a lower risk of dying from any cause than the second person because these are independent risks. That is, even though both people train for an hour, one has more risk than the other because one is sedentary and the other is not. One spends many hours sitting and the other does not. Remember, there's another thing that's anecdotal but significant to me. Don't you notice a seductive music in your ears after eating that inevitably makes you go take a nap? It happens to me, and I'm sure it happens to some of you as well. This nap is not bad at all. In fact, the nap in many contexts has benefits. But yes, some days, and that's why I say it's anecdotal because it's based on my experience, I would like to be more productive after eating and not have to take a nap or start working much earlier. But really that tiredness, that sleepiness after eating prevents me from doing so. I've noticed that you can stop that inertia to take a nap, that sleepiness, that tiredness, that drowsiness that we say here in Andalusia after eating can be greatly slowed down by going for a 10-15 minute walk after eating. Try it and tell me how it goes. Leave it in the comments, and of course it will also contribute these small exercise pills to the caloric deficit. And this is more significant than you think because once again there is that conception that 10 push-ups are useless, 10 squats are useless. It seems that if we don't suffer a lot, if we don't have that feeling of having sweated, having suffered, then we haven't done anything. But if you start to add up throughout the day, you have done a lot. In fact, this approach to exercise can even be more beneficial for a part of the population that does not like to train or does not enjoy training for a considerable period of time. Why? Well, because maybe this 10-minute walk does not involve brutal physical effort, or those 10 squats do not involve brutal physical effort and do not deter many people who do not like to exercise. And that's it. We have to assume and accept that there are many people who do not like to exercise. And perhaps these almost imperceptible small pills can be a good solution for those people. Think about it, reflect on it. In conclusion, small exercise pills, especially after eating, and I'm talking about light, moderate intensity exercise, walking, a few push-ups, a few squats, light, moderate intensities are also beneficial. They are very beneficial and can be even more beneficial for certain sectors of the population. Remember, you're hearing from a high-intensity exercise enthusiast. Moderate or low-intensity exercise also has its indications and benefits. Yes, see you in the next video. A big hug and keep empowering.